Okay, don't forget tomorrow. Tomorrow we have a double header day. In the morning we have Rabbi Markowitz that will be on Zoom, and then we have a lunch and learn tomorrow. We have the who makes the best hamburger contest. If you haven't made a reservation for that, you can catch that on Zoom. Okay, well, whenever you're ready.
Okay, good morning, everybody. There is a whole section in Shulchan Aruch Yeridea that deals with the period of time prior to death. A person who is going to die, and it's not reversible, is known as a goses. I'm not sure of the exact derivation of that word, but a goses is a person who is in imminent danger of death. How close, how soon, matter of debate. What I want to talk about is how we treat those people who are dying. This is different than Bikur Cholim. Bikur Cholim is a whole separate situation. Bikur Cholim concerns people who are ill, who will recuperate, will get better. A goses is a person who is terminal, whether it's a month, a week, a day, an hour, that person is considered a goses. Traditionally, if you look at the Chumash, Avram, Yitzchak, Yaakov, the Avos, they prepared for death. They accepted death. It was a natural, death is a natural part of life, if you will. And they gathered their family together, and they gave their final instructions. They gave out their blessings and so forth and so on. But it was something that was accepted. It was something that was almost comforting in many ways. They were at home. They had their families surrounding them, their children. And they died, in most cases, a peaceful death, surrounded by family. Today, it's very different in many cases. In the past, 60 years or so, maybe less, maybe more, I'm not sure exactly, but usually in today's society, more often than not, death takes place in a very sterile environment. It takes place in a hospital room or a nursing home. The patient is surrounded by machines and all kinds of medical people, and it was a very sterile environment. And I would like to present that halakhically, that is not an optimal situation. When the situation is not reversible, when death is going to happen, and it's not something that if you have a situation where a person is ill and we're trying to cure that person, then of course we must do everything we can to ensure that person lives and is cured. But when everybody has agreed medically that death is imminent, and the question is how imminent? Is it 6 months away? Is it 6 weeks away? When a person is sure and the family is aware and confident that this is the end, then I think we have to make every effort to ensure that that person is in the most comfortable atmosphere and environment, surrounded by family, to leave this world in a less than sterile environment, as happens very often. The person is in a hospital or a nursing home. Hashkafically, if I can use that word, Jews should not be afraid of death. Death is just another stage of life, if you will. Death, it takes you to the next level. Judaism affirms life in every possible way, and we try to preserve every last second of life. Nevertheless, we understand that death happens. And once one accepts that fact, that makes the transition perhaps a little bit easier. Nobody likes to die, with the possible exception of a person that is suffering and in tremendous pain. We have to do everything we can to alleviate that pain. There's, we can't, it's a very fine line. We can't really pray for somebody to die so that their pain is ended. Persons in tremendous pain and suffering, we don't pray that a person should die to ease their suffering. It's a very fine line. And there's a fantastic story in the Gemara. Yudah HaNasi was dying.
Hello there.
And he was having a very difficult illness, and he was suffering greatly, suffering terribly. He was in his 80s. And the students were praying that he should recover. And his nurse saw how much pain he was in. So she ran up to the roof and she shattered a glass bowl. And in that split second, when she shattered the bowl, all the students stopped praying because of the noise. And during that split second, he died. So all the Mefarshim on this, was she praying for him to die? And the answer that most Mefarshim give is that no. She was praying that his suffering should stop. I'll put a fine line on it, if you will. The point is, we don't pray for someone to die, but we pray for someone's suffering should end. But there are situations where we can't prevent a death from occurring. And the most difficult thing in many cases, or sometimes might be easy, is for a person to accept the fact that they are dying. Do you tell a person that they are going to die? Or does a person intuitively know it himself? Technically, you should never tell a person you're going to die. I mean, the doctors tell you that this is irreversible and the cancer is eaten away, or this intestinal issue, whatever it might be, he's got 6 months to live. You don't tell that to a person. However, when it gets close to the end, we try to encourage a person to say vidui, the final confession. Now, we also tell a person that there are many people, and we know this to be true, where doctors have given up all hope, and somehow that person pulls through. People say Tehillim, people pray for somebody, and even though doctors don't understand how it happened, Nes min hashamayim, whatever you want to call it, that person pulls through. There are many people who die, unfortunately, without having said vidui. There are many people who say vidui, and they survive. To go on to say vidui perhaps at a later date. All this is in terms of an introduction to this relatively, I say not recent, but it's been around for a while, phenomenon known as hospice care. Hospice care is an attempt to make the person who is dying as comfortable as possible. When the medication is not going to help, when all the machines are not going to help, it's much better for a person psychologically to be at home in his own room, in his own bed, surrounded by family, being made as comfortable as the situation will allow. That's what hospice care is all about. It could take place in an institution, in a nursing home. It could take place in a person's home, but definitely not in a hospital, surrounded by machines and everybody dressed in white or whatever color of the day. Nurses don't wear white anymore, I think. Different colors in the hospitals now. But a hospice care is geared towards making a person as comfortable as possible during whatever time they have left. And usually a hospice nurse will visit the home every day, make sure the person's getting medication that they need, and so forth. We don't tell a person that they're dying, but I am sure that most people in that situation, if they are mentally aware, know that the end is coming. We tell a person to recite the final vidui, which basically is an acceptance or an acknowledgement that HaKadosh Baruch Hu is the final arbiter of who shall live and who shall die. We ask that if I'm guilty of sin, that my death be a kapara and so forth. The language of the vidui is very, very fascinating. Yeah.
Why is it a halacha not to tell a dying person who's dying, especially if he doesn't?
Yes. You shouldn't tell it. I mean, because
if someone's not feeling well,
right,
and it's not like you can see a broken bone or horrible bruises, they really have no idea. So you go to your doctor, get all these tests, and it turns out the test, the CAT scan, whatever, shows that there's a tumor, let's say, or nothing visible. And the person isn't like super sick, but sick enough to know to have gone to a doctor. So clearly, that person's going to want to know, okay, doctor, what did the tests show? What did the CAT scan show? And let's say the doctor happens to be thrown, just to make it a little more specific. Is he supposed to lie to the patient? Halachically? I would hope not.
Lying is a very strong term.
Is he not supposed to tell the patient?
You tell a person,
you have a tumor and you have 6 months to live, leaving.
That's a very important question. You have to know your patient. And if the patient is totally unaware, this came out of the blue, and the person is young, let's say, you have to be very delicate in how you tell a person you have a tumor and it's inoperable, and I'm not sure the prognosis. You're not going to say you're going to die, because the truth is nobody knows exactly. So you're not really lying when the doctor says to the person, it's very serious, we're looking into it, and we're trying to do whatever we can to ameliorate your pain or whatever.
And what if the patient says, doctor, you think I should be putting my, whatever the word is, something in
Put your affairs in order.
Right,
Yeah. I think that's always good advice. People will tell, people who are in the business of protecting people's assets tell you very early on, get your stuff in order, in your 40s or 50s. Because one never knows. Have a portfolio just in case. People should know where your stocks and bonds are. People know what investments you have, and that the children should know. Somebody should know. The executor of your estate, have a will. By the way, if you don't have a will, get one, a halakhic will. Get one written up. It's very, very important because things happen. Yeah.
I guess back in the day when people died relatively suddenly, and when people died at a much younger age, 40s, 50s, that's when people, you're not going to tell somebody this is a chronic illness, this is a terminal illness. But today, people have a different mindset. Most professional people want to know when the end is coming for that precise reason that they could, from those who have a bucket list, and from those who want to put their affairs in order, or for those who want a religious.
Well, yeah, a lot. You're right. A lot depends on, first of all, how old you are, where you are in life, what your situation. Everybody's situation is different.
Where you are, current day medicine.
Yeah, okay, but be that as it may, with all the advances in medicine and all, the fact remains that there is nothing that is definitive beyond 99%. The doctor can say, tell the family, look, your father is very ill, and in all probability, he's not going to make it more than 6 months. But, a lot can happen in 6 months. New scientific advances can be made, new procedures can be developed, things that are experimental will now become mainstream, or maybe we can try an experiment. There are all kinds of things, we never know. And we also know for a fact that there are documented cases, many cases, where doctors have given up on somebody and miraculously they survive. I remember years and years ago, who was it? Norman Vincent Peale, you know that name, in the 1950s, wrote a book called The Power of Positive Thinking. And he documents a situation where a person had terminal cancer and he willed himself to live, and he lived. He beat it. He defeated the cancer just by positive thinking. Now, I'm not saying this works in every situation, but and you have definitely need medical care. However, we know of situations, people who were davening for somebody, people who were sick in the hospital, people say Tehillim, and doctors give up hope. Somehow this person. So we have many documented cases. However, getting back to the original concept, yeah.
So you said you should be telling the patient, but how about the patient's family? And number two, getting that by not telling the patient, there are also alternative methods of care
Yes,
that sometimes can work a certain.
100%.
If you don't tell a person that you have 6 months to live, that person might not look at that as a term.
So
You might be doing a disservice.
So
and also to the family, you know, after 6 months, if this person dies and they don't know about it, the shock,
Yeah.
value there, is tremendous.
There are
They think,
definitely-
"No, I think this person is gonna die."
there are multiple scenarios here. In most situations, when there's a family involved, children are aware of a parent's prognosis, and they try very often to shield the parent from that prognosis because bad news could also have a negative effect. And the Shulchan Aruch, however, understands that there are some, for example, you can't do anything to actively assist in death. That's called murder. However, if a person is dying, the example given in the Gemara, and there's somebody who's chopping wood outside the window, and the noise basically is keeping this guy alive, in pain, but the noise is not letting him go. You can tell the wood chopper to stop chopping and let nature take its course. So there is a little bit of wiggle room here. But going back to the original concept, hospice care, as opposed to medical care, when medical care is no longer indicated, when medical care is not going to do the job, take the person home. Let a person die serenely, peacefully, surrounded by family, in his own room, in his own home, because it could happen that prayers will work and Tehillim will work. On the other hand, if not, at least a person should be able to die in a calm, peaceful surrounding. And the halacha is very, very concerned about not only what and when you tell somebody, but also how you tell somebody. You don't want to make a person upset more than naturally being sick. Most people who are dying are aware that the end is coming. They are aware, they feel it, they know in their bones that the end is coming. And most people try to have their last will and testament and give out final instructions to do whatever they want to dispose of their assets and so forth. But I think bringing back the human element in dying is the bottom line. That a person shouldn't be surrounded just by machines and strangers at the end, when it's not going to help anyway. Yeah.
Halachically, I knew this once, but I can't remember it now. If someone is in the hospital, let's say, is surviving just because he's on an IV or a feeding tube or something like that, halachically, I don't think
You can't pull the plug.
Right.
No, you can't. You cannot pull the plug.
And that would include the feeding tube, right?
Yeah. Yeah, and here's
So
where,
then what can you quote, scale back for the sake of a smoother, perhaps faster end when there's no alternative?
okay, so the idea is to make this final transition as calm as possible. And pulling plugs and wires and sticking and needles, all this kind of stuff is very upsetting and destructive to a very ill person. So if it's in already and a person is getting nutrition through a feeding tube, you can't stop that. Because taking it out is a quasi-surgical procedure by itself, and it's painful. But not put it, so that, or you don't, for example, well, let me rephrase it.
Might be put in for the severity of the situation.
Well, you don't, let me put it this way. You don't have to hook a person up. You don't have to do that to artificially prolong life. You're not required to hook a person up. But once you hook them up, you can't unhook them. And it's a very difficult decision to make. A person's dying. You can prolong his life for a certain period of time by hooking him up to a heart-lung machine or whatever it might be. You can do that. But once you do it, you can't unplug it. And the question is, do you let a person die naturally, perhaps a few days or a few weeks ahead of schedule, had he not been hooked up? And the answer is yeah, because you're not obligated to artificially prolong something that's going to end anyway. Yeah.
Yeah, unfortunately, you're gonna have to start including this year. The current trend that's happening in most civilized countries about doctor-assisted termination of life, and that's coming.
Well, it's here.
It's here, so it's gonna come to the.
But doctor-assisted termination of life has another name. It's called murder.
It depends on what the assistance is. I remember, I don't have to mention the name publicly, a Rav once said the person was in very dire suffering. So the question was, could they leave a bunch of pills by his bed, not to administer it, but to let him know the pills are here. If he takes them, they're probably going to induce unconsciousness and hurry death. And the Rav said that was considered. I don't know if the psak was to do it, but you'd be surprised if it is. I'll tell you later.
Nothing surprises me, but I would be very.
Wally,
Yeah, I'm nothing surprising. Put it that way. One second. Yes. Okay. Right. Yes, yes. So that takes broader shoulders in mind. Whether you should, stop dialysis, because that's a physical monea. You're actually physically hastening death by not allowing the patient to continue that particular medical treatment. That's a very difficult question to answer. If a person doesn't get dialysis, they're going to die. That's a very tricky question. It's a very tricky question. I'm not sure which category that would fit into. That's a very good question. I don't have an answer to that. I suggest you ask. Yeah, all right. So that's a very good question, and you'd have to ask somebody with broader shoulders in mind to give a psak on that. Yes, Nathan.
Wally, yeah, placing the pills on the table, wouldn't that be leaving it over there?
So that was a question that Abe just asked. Can you put pills on the table? Again, it's a very gray area, because by a person taking that medication, they are in a certain sense committing suicide. So that's a very dark gray area, which, again, if somebody would allow that, it takes, broader places than mine. Yeah.
Also, going back to what you said, some people that, let's say, are on dialysis, and they might even be on kidney transplant list, and it's just schlepping along, and they're older, and the guy says, enough, I can't take this dialysis anymore.
Okay, so sometimes,
So if he's making that decision.
yeah.
Would that be considered on the route to a suicide?
Not real. I mean, because when the cure is more painful than the disease, and a person, I can't go through this anymore. Just let me go peacefully. A person has the right to do that himself. An individual can't prevent someone else from getting it. But if a guy says to himself, I had enough, I can't do this anymore, I'm ready to go. That's it. Whatever happens, happens. I'm not going to subject myself to another treatment, which is very, very painful to me. It might, in fact, even hasten my death. But if I just don't want to go, I don't want to go through it anymore and let nature take its course. Again, there was a time in history where we didn't have all these miracle cures. And when people got sick, they said, it's my time, I'm going to go. Goodbye, I love you all. Take care. Here's my instructions. Say vidui, and that's it. Today, with so much medical care available, there's a lot of questions have to be asked. Do you prevent the care? Can a person refuse care? These are a lot of interesting questions. And this is why when you get to a point where it's near the end, usually a few months before a person is scheduled to die, use that expression, that's where hospice care is very important, to make the person as comfortable as possible. And there are hospice nurses that come to the house. They're specially trained to deal with this, as opposed to, you can have hospice care in a nursing home too, but definitely not in a hospital. Because a hospital is a very sterile environment, and traditionally, when people died, their family was gathered around them, and to make it as comfortable as possible. Children there, the grandchildren, and you look at Chumash, Avram, Yitzchak, and Yaakov, they called the grandchildren, they gave them brachos, they said, this is for you, this is, that would be the ideal. We are very often very far from that ideal, but death is a part of life. It happens to everybody, it's unavoidable. Sometimes you can prolong life, sometimes you can hasten death. And there's a fine line, and that's why we have halachos and rabbanim to guide us when you have these types of questions. Can you put pills near the table? That's a very iffy type of thing. Because, a person taking their own life is a very, very serious avera. You can't commit suicide. But if you can take a pill to ease your pain, that you can definitely do. Now, you take too many pills, you ease yourself out of life. So again, that's why we have guidance. That's why you have hospice nurses, to make a person as comfortable as possible during those last minutes. The unresolved question, and I just want to close with this because there's no real clear answer, is when do you tell a person that they're dying? The person is totally unaware, which sometimes happens. Some people know when they're dying. People know if they're very sick and they know the end is near. But there are some people who are either blissfully unaware or don't want to know. And should you tell that person, listen, you have this tumor that's growing inside of you, and we don't know it's going to be 6 weeks or 12 weeks, but it's going to kill you, and you're going to die. Do you tell that to a person who's otherwise unaware that this is a possibility? And that's a very, very gray area. On the one hand, a person should know so he can prepare and make whatever preparations he needs to make. On the other hand, by telling a person, you can affect them, their mental state, and maybe hasten their depression or what have you. Milton.
This person can speak about not prepare in advance his last
Well, again, everybody should prepare. In,
Let's say, saying you ask this question, if you know that this particular person did not prepare yet, is
all right, so,
if he didn't do it,
so you have
that's
to,
different than if the person did it.
yeah, that's a very good question. If a person did not buy cemetery plots and did not make out a will, a halakhic will, and did not do all these things, that person should be informed in as nice a way as possible that maybe you want to think about these things. Not that you're going to die, but you know, you're getting on in years, and maybe it's time to prepare for your children and grandchildren, put your affairs in order.
That's a little bit different than one that you know that he had prepared.
Yeah, each situation is different, yes, sure.
Just a question, I don't know. If a doctor doesn't say to the patient, you know, like, the family says, doctor, please don't tell dad, blah, blah, blah. And the doctor has shared with the family, isn't that against HIPAA laws? I'm serious.
That's why, actually.
No,
It
because,
always depends.
and they say, who else can know your information?
Yeah,
You always ask you in advance to fill out.
right.
Who else can know?
So you saw, if you filled out a form, then the children could be informed, and it's not a violation.
That's
Yeah,
why you should always.
And then you have your kids arguing what to do.
yeah.
That's what you should.
And by the way, if a patient is comatose, don't have the argument in the room, because 9 times out of 10, they can hear you. Yeah,
Perhaps the most powerful advertisement that you hear on the radio is Plaza Memorial Chapel. We're all going to need it.
yeah, we are. Anyway, hopefully, those who are ill should have refuah shalema, and there should not be a concern for many, many years down the road. But these are important areas, and the halacha does deal with them. And some of the questions that come up, like the pills on the table and so forth, and when you tell them, and what you tell them, and how you tell them, these are, you know, not necessarily strictly halachic parameters, but they're certainly common sense parameters, and we have to apply them where appropriate. So all those that are ill should have refuah shalema, and people should live long and healthy, prosperous lives.
Maybe we can have
Amen.
Thank you, Wally.
Was that your?
an upbeat topic.
An
next
upbeat,
time.
more upbeat topic next time, but I think it's important. All right.
Thank you, Wally.
Have a good day, everybody. Okay. We have a Zoom?
Yes.
Okay. Okay, good. Leave. Ishen I Baruch Me'atov Yad Olam. Rosh Hashanah Shalom Tovachayinu. Kivla Kol Michin Mazon Chol V'Yasar B'Shel Borov Rovato Adonai Hazon Hey.